Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever, whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.
Hello, everyone. I'm Barbara Ham Lee. You may be familiar with the names Adderall, Ritalin, Xanax, Zoloft, psychotropic medication used in the treatment of mental illness and capable of affecting the mind, emotions, and behavior. Now, there's a steady increase of prescribing these drugs for children. But what are the long-term impacts? Up next on Another View, over-medicating our kids and what parents and caregivers need to know. And we pay special tribute to spiritual leader and social justice advocate, Father Joseph Green. Stay tuned. Another View is coming up next after this national, regional, and local news from NPR and WHRO News.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Ham Lee. Let me start by saying Happy New Year to my co-host for Another View on Health, cardiologist Dr. Keith Newby, who has a different sounding voice today.
Listen, you're not supposed to say that already.
How are you feeling?
I thought you were looking out for me.
I am. I know, because I didn't want people to go, what's wrong with Keith's voice?
Well, I appreciate it. I was getting over a cold, not COVID. I tested negative twice. So,
Okay.
But I'm back, almost back to my baseline. I'm waiting for my voice to come back. So bear with me today, audience. I will get there.
Absolutely.
But thank you.
You will.
Thank you for the concern.
Oh, absolutely.
Thank you for looking out.
We're always concerned about you, Keith. You know that. So you know what? On today's show, we're going to be talking about over-medicating children. And there's so much interest in this topic. And we're going to get to that in just a moment. But first, we're going to pay tribute to Father Joseph Green. His legacy of service to the city of Norfolk and the Hampton Roads community is lengthy. He lived his life by giving back, from serving as a hospital corpsman in World War II to 20 years of service on the Norfolk City Council. Our Lisa Godley looks at his impactful life as a humanitarian and a servant of the people.
Born in Jenkinsville, South Carolina, Joseph Green grew up helping care for the family's crops and livestock. In fact, his goal once he finished South Carolina State was to study agriculture, but the Second World War would change those plans. He was called into the military. After the war, he set his sights on the priesthood. He attended St. Augustine's College and continued his theological studies at the Philadelphia Divinity School. He came to Norfolk in 1963 to pastor Grace Episcopal Church. During that time, the city was still segregated. Green's desire was to make Norfolk a better place for all of its citizens. So he questioned why the Young Men's Christian Association would not allow blacks to stay there.
They thought I was a rabble-rouser, even as a priest, because I was trying to integrate the why. That was my first attempt to make sure that Norfolk would be a city that was open to everybody.
This patient priest would serve 20 years on the Norfolk City Council. During that time, he led the charge to open a Tidewater Community College campus in downtown Norfolk. Of his many works, Father Green says the one thing he's probably most proud of was the role he played in helping to restore the Addicts Theater.
Musicians of the greatest caliber performed here. Great players played here. I looked around when I was a member of City Council, and we were restoring all kinds of buildings in the city, and the city was spending money on the Opera House. We completely did that one. And I said, why don't we have anything in the African-American community that we are trying to restore? And I looked at the addicts, and it was the only building left. I thank God I had a hand in restoring it.
Father Green pastored Norfolk's Grace Episcopal Church from 1963 to 1993 and was later named Rector Emeritus. When he was 92 years old, he said, "I've had a great life and a great wife." At the time, the two had been married for 63 years. He said he had a blessed life, and it was one that surely blessed the Hampton Roads community. Father Joseph Green passed away on Friday at the age of 96, surrounded by family.
And our sincere condolences to Father Green's family and to everyone who loved him and knew him and worked with him. Keith, you knew him also, did you not?
Very much so. Even growing up, I knew him from my family's knowledge of him and working with him. My father was actually the first African American on the City Planning Commission. So there are a lot of firsts that came in that generation. So my deals with him were that, but then he came to me as a patient later on, and I helped with him for almost 20 years.
Wow.
So I knew him quite well and was saddened to hear of his passing, but a true servant, not just in a pastoral role, but just as a community advocate. There was just no one like him. Even in his 90s, he was taking kids places, trying to mentor them. So you look at somebody who says, I'm going to not just take, the time to do what I have to do for me, but I'm looking out for other people. What can you say to something like that?
Absolutely. That's who he was. Father Green, we just wanted to make sure that we paid homage to the work that he's done. And we'll be right back. And welcome back. Are you aware that in 2022, Virginia ranked 48th out of 50 in terms of youth mental health services, and that Hampton Roads has the highest ever documented rate of psychotropic drug use among children? Why are so many of our young people on these drugs, and what is the long-term effect? Joining us to talk about medicating normal is Dr. Gretchen LeFever Watson, clinical and psychiatric psychologist in Virginia Beach. How you doing, Dr. Watson?
Great, Barbara. Great to be here with you.
I am so glad that you're here also. And joining us by phone is Ms. Sade Daniels. She's managing training director for the California Youth Connection, which is a statewide youth-led organization working to transform the foster care system through legislative policy and practice change. How are you, Sade?
I'm good. Excited to be here with you all today.
Thank you so much for joining me. I appreciate it. So let me start with you. Do you mind if I call you Gretchen, or would you prefer Doctor?
That's fine.
Okay. I meant to ask you that before the show. But Gretchen, tell us, what is a psychotropic drug and what does it do?
A psychotropic drug can refer to any number of different types of drugs. So if you think about drugs that are used for depression, anxiety, ADHD, any of those kinds of problems, even psychosis, those are psychiatric or psychotropic drugs, and they affect the mind and also the body. So it's a large class of drugs that have become very commonplace.
And were they not designed for children?
They were not designed for children. What happens with psychotropic or psychiatric drugs is they get tested first on adults, and then later the boundaries are pushed to see whether or not we can use them safely and effectively with children.
Now, I know that there's a documentary called Medicating Normal. It did air on PBS, and it is going to be shown here in the Hampton Roads area. Tell us about that, and then we can go into more of the discussion of what people may expect.
Okay, Medicating Normal is an amazing documentary. As you said, it's aired on PBS. It is really a story or a film that reveals a lot of information about being on a psychotropic drug for a long period of time and what that can do to people, and then what can happen to them when they come off of the medication. It's such a powerful film that one reviewer said, anybody who knows anybody who has any connection to any one of these drugs ought to see this film. And that means everyone. Wow. This film will touch anyone who watches it. They will really be moved by the information that's in there. It's all very scientific information. It is a film that interviews leading experts in this field, as well as following the stories of 5 patients, all of whom were on different types of drugs for different reasons. And it's just a really eye-opening film that we are so excited to bring to our community. And we think it's so important that the Richard Fee Foundation and Periscope Foundations have come together to make sure that the airing of the film in Virginia Beach at the Sandler Center is free and open to the public.
Okay, so anyone can come. Tell us when it is.
It is January 26th at the Sandler Center. Doors will open at 6 p.m. and we'll have booths and people around and information that people can review and talk and engage. And then at 7 o'clock sharp, the film will start. And then after the film, there will be an expert panel of people who will give very short presentations that help round out some of the information that's discussed in the film. And then we'll go into an audience question and answer session, which we're really looking forward to because we know that it's so important to talk to and with the community about this issue.
So in the film, they follow 5 people, and those 5 people that were followed, one was African American, the other 4 were white, but all of them seem to have had access to insurance. They were young adults and so forth. But there's a population of particularly African American kids that are also being treated with these drugs, and that's in the foster care system. And Sade, I want to bring you into the conversation because you actually were a part of the foster care system in California. Is that right?
Yes.
And you experienced being placed on these drugs. Can you tell us about your story?
Yeah, absolutely. So in care, I mean, and I'm pretty sure most people are familiar with the foster care system, but generally it's a system where children are separated from their family due to allegations of abuse or neglect. Nationwide and historically, it's been primarily neglect that children are taken away for and then put in substitute housing, so with a foster parent and a group home placement. For myself, as well as the work that I've done in my adulthood, a lot of my experience centered on congregate care placement, so the group homes, which is actually disproportionately used for African American children, the more restrictive placements. And in those placements, oftentimes the idea is that you have more adverse behaviors, higher acuity, if you will. So oftentimes in those group home spaces, like young people are considered more behaviorally challenged, which kind of creates this pipeline towards psychotropic medication. So you'll see in the state of California, at least, and as well as many other major states with like high populations of African American children, you'll see that there's higher rates of psychotropic medication being given to those kids that are in the most restrictive placements who just so happen to be African American children. For myself, I recall going to seeing a psychiatrist for 10 minutes talking about my feelings when I was 13. And after 10 minutes, I was diagnosed with manic depression. And at the time, I didn't really understand what was going on, but I was also offered medication for sleep. So in my mind, I was just like, okay, if y'all are going to medicate me, can I at least get something that would help? Because at this point, I'm not sleeping very well. And I remember taking a couple of days later, taking the medication and just the effect that it ended up having on my functioning. So we call it, we were zombieing. That's what we called it in the placement. And that's basically like our feelings are numbed. And I'll never forget it because we were told, it doesn't necessarily take away this. It just takes the edge off. It takes
but for you, I remember, tell me, so for you, did it take the edge off or did it just make you completely unfeeling?
Despondent.
Wow.
Despondent. It didn't really take the edge off. I could still feel everything I was feeling. So like with the diagnosis, now that I'm a professional in the field, I can say I was definitely misdiagnosed. But, these are the effects of trauma. Children are being taken away completely separated, not just from their families, from their communities. And if we're talking about African American children, oftentimes from their culture. And completely taken out of that space to another where they're in spaces that, if we're being honest, white professionals oftentimes lead a lot of the processes. So for foster children, it's a white attorney, it's a white social worker. Sometimes it's even a white placement or white adoptive parents. So you're now completely disconnected, not just from your family, but oftentimes really important cultural aspects. That's traumatic. That's trauma.
Sade, what was going on when you went to see the psychiatrist? Can you just give us a little sense of what was happening with you? What were you doing, or was there a behavior? How did you wind up going to see a psychiatrist to begin with?
Honestly, they took all of us. We all went on the same appointment. So
it was a group. It was like a group meeting.
I hate to. I'm 34 years old now. And this all happened when I was 14. And I remember it so vividly because it was very confusing to me. So, yes, it was, they made appointments, and about 4 of the girls in the house of 6 all went. And when we went, we didn't really know what was happening. We just knew that it was a medical appointment and that quite a few of us had it. And so one of my friends, one of the girls that were there, they did know because they had been at another group home where the same thing had happened. So she basically told me, it's not going to take too long. You're only going to talk to her for no more than 15 minutes. And I asked, like, what's the point? And she was like, it's for medication. I'm like, oh, like Robitussin? Like, what kind? And by that point, it was time for me to go inside. But yeah, I remember it all because it was very confusing to me, but we were all taken there. It's almost as if it was custom. It's common practice, if you will. And again, I will always speak to race being such an important factor here. If these type of placements are heavily overpopulated by Black kids, and they're always tagged with the behavioral issues, the extreme mental distress, then it ends up being that these medications are what's going to, quote unquote, basically control our behaviors. So then you see a lot of younger Black kids in foster care being diagnosed with these really, really big diagnoses: manic depression, bipolar, at times when our brains aren't even fully developed, and also in a space when trauma was never adequately addressed.
Keith, do you have any questions?
No, I think her last comment, I think, was what was key was whether the underlying problem was actually addressed first. As a physician, at least, and a cardiologist, I have to prescribe medicines regularly. But, my particular viewpoint is always I do it in conjunction with the patient. And we talk about risk, benefit, pros, cons of any medication that we're looking to try to initiate. So when you talk about these kind of medications, the first thing in my mind is, has the underlying problem been addressed that created the issue that is looking to be treated? Because medications aren't just, aren't the answer to everything. You have to look at, why is this what happened to the person that's making a physician think they need the medicine? And once that's been addressed, or has it been addressed, is it being used in conjunction with talk therapy, or is this just like a pacifier? And that's the part I don't know yet because I'm still learning about this. I watched the film and I understand the kind of the dynamic, but that's the part that seems like is always left out is what leads to the medicine being given, and was it adequately addressed prior to, meaning what the issues are, some formulation of a plan to address the underlying problem, then look at a medication to initiate. So and that's the part that I couldn't get last night.
Yeah. Sade, and I'll come to you just a second, Gretchen. Sade, did you go through any other counseling outside of the medication, or was it just, here, take this pill and go sit down?
Yeah, so I had court-ordered therapy is a common part of a lot of case proceedings for young people as well as their families if they want to get them back. But the psychotropic medication came almost immediately to my entry into foster care. I'd say probably about 4 months in. So it wasn't like, we're going to do therapy or do other types of mental health programming to support you first before we go this route. It was almost like it's a simultaneous thing. You get on therapy, you go to some support groups, and you're on this psychotropic medication.
Gretchen, you want to respond?
Dr. Newby was saying, it's hard to get a handle on where we are now, and it is hard to find the numbers and understand how this plays out. We have improved since the time Sade was in foster care, but we have a very long way to go. So, for example, if we look at the most recent report in Virginia, children in foster care compared to other children on Medicaid who are not in foster care are 5 times more likely to be diagnosed with ADHD, 10 times more likely to be diagnosed with anxiety and depression, which makes sense. We think, well, a diagnosis of anxiety and depression might be okay because these children are anxious and depressed, but not so much. When we put that label on the child, we're saying there's something wrong with the child, that the child has a disorder. There's something in them that needs to be fixed. When who among us wouldn't be anxious and depressed if we were just ripped out of our home, and a home where maybe things had been far from ideal all along? It doesn't matter. You still know home and you still crave to be in your familiar place. So we would expect children to be anxious, depressed, and exhibiting a lot of troubling behaviors, but yet they're getting diagnosed with conditions just way too often. And in Virginia, we know the CDC has looked at this. They looked at all 50 states and how often each state uses, for example, psychotropics to deal with children who've been diagnosed with ADHD versus behavioral treatments. And Virginia has the highest level of drug use and the lowest level of non-drug therapies
for ADHD.
But ADHD in childhood really is the leading diagnosis. It's the gateway diagnosis for many children. They get that diagnosis first, and they get put on medication, and then they have side effects from the medication, which leads to another diagnosis and more medications. And before you know it, they are on multiple psychotropics, which we saw here in Hampton Roads. We were leading the nation, unfortunately, in terms of putting large segments of our children on multiple psychotropics at the same time.
757-440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. Do you have a child that has been placed on a psychotropic drug? What kinds of questions did you ask before giving consent, or did you feel like you had enough information? 757-440-2665 or 1-800-940-2240. Mark joins us from Norfolk. Hi, Mark. You're on the air.
Yes, how are you doing? This is a wonderful topic, and I'm a father of 4, and I have interfaced with many of parents who have kind of gone down this road, this winding, infinite road. And a lot of the incentives are just in the wrong place. So, like, number one, a lot of parents don't know that they actually have the legal option to get an independent evaluation of their child outside of the school system that they're in. That's the first thing. The second thing is, when I say incentives in the wrong place, once a child is then labeled disabled, then you have, a parent or parents now that are able to, some of them get from anywhere from $600 to $750 a month.
You're talking about the foster care parent or regular parent or their parent?
No, just a regular parent, because what happens is they go through the pathway of getting their child disability status.
I see.
And then through that SSI, they have anywhere from $600-700 per child that now is becoming regular into the household. So who wants to stop that faucet from dripping, right? So then you got the pharmaceutical company that has a boxed-in, large audience with incentives all over the place for them to continue to pump these drugs. And then what a lot of things that a lot of people aren't talking about, side effects like young men becoming impotent, young men growing breasts. So there's a whole lot to this big picture. And I do think, though, although the money is appetizing to some of the parents, I think if they really, really understood the big picture of what this does long term, I think a lot of people would maybe take a second look before they actually put their children on drugs to try to induce unnatural behavior versus, like the doctor said, trying to get at the root of what is causing the issue and putting in the work to circumvent the behavior.
Okay, Mark, thanks so much for the call. He's dropped a lot of information there, and I'm going to give you a chance to respond in just a second, Gretchen. But if you're just joining us, we're talking about the impact of prescribing psychotropic drugs to our youth. Our guests include psychologist Dr. Gretchen LeFever Watson, Sade Daniels with the California Youth Connection, and my co-host for Another View on Health, cardiologist Dr. Keith Newby. You want to respond to Mark's?
Sure. One of the things that Mark said that just is really important for everyone to understand is the long-term effects of these medications. So most people, including most doctors, don't fully appreciate that what little information we have on the safety and effectiveness of these drugs is based on very short-term studies, like we're talking weeks long. Mm-hmm. But what the evidence is now clear for those of us who really follow the scientific literature closely, but doesn't break through usually to the popular media or to what doctors necessarily even hear about, is that long-term, these drugs are not very effective and actually can be quite harmful. So every single one of the groups of classes of psychotropic drugs that are currently available will eventually, because of built-in dependence and tolerance factors, actually worsen the very symptoms that they're designed to treat. So you might put a child on an ADHD medication, for example, and they will have a positive response initially. And the parents and teachers or doctors will think, oh, that's good. And then after a while, they need more and more, and eventually they get on too high of a dose, so then they try adding and switching medications, and they get into...
And that's how they get into that multiple use.
Yes.
Sade, how long were you on the medication, and what made you come off?
I was on from age 14 to about 16 and a half, like actually 17.
So 53.
And yeah, so about 3 years.
Mm-hmm.
I entered into more independent housing. So really the group home required it. Once I got into a transitional housing living program, I had a little bit more agency over what I was taking. And I also started to learn the effects of what I was taking, started to kind of see that I wasn't, I was really not doing well in school. I was struggling with a lot of things. And it took me a while to start to see that the medication had an impact on all of that.
Mm. So, and one of the issues that is an issue in terms of, especially for children in foster care, and I'll start with you, Sade, and then I'll go to you, Gretchen. Who's making the decision? I mean, because you made a very strong statement, Sade, when you said I had agency. I finally had a voice to say what I wanted to do in that process also. But when kids are young, or even when you first started at 13, it's who's speaking up for you to make this decision.
I think this is why it's a very important conversation to have, especially in regards to foster youth. Because the gentleman I just called, he talked about, his children and how important it is for families and parents to be educated. What's important to note about children in foster care is that natural advocacy that comes with the parent is not there. So in reality, we give it to that power to social workers and attorneys who sometimes are not as educated on the impact of these medications, but are more so consumed with how do we get this young person to stay in their placement? How do we get this young person to not have these specific behavioral reactions? So it's not about the well-being of that child. And you also don't have a parent who has, if a lot of parents lose their medical rights of the child, meaning that they no longer can make those decisions when they're in foster care. So in reality, I'm trying to figure out the best way to say this, but there's very few people who are actually actively advocating for this child. But as far as who has the power to administer, once you get a diagnosis and you get a court order that approves it, that child is able, and oftentimes it's mandated to take those medications. Wow. Especially as you get younger, you have rules where the placement administers it. You don't actually have the right to say, no, I don't want to take this. But I do see a lot of states building up their Bill of Rights for young people in foster care. So they have a little bit more, like I said, agency to say no. But that requires education across the board. But for my own process, a psychiatrist said that I was diagnosed with this, and I was given a diagnosis, and then it was taken through my social worker, who then petitioned the court for a court order that allowed me to take that medication. In most states, it's court ordered if you're in dependency.
So there's a long list of or group of people that have to be knowledgeable about this.
Oh yeah.
In order to do this diagnosis in the beginning. Our phone lines are lit up, so let's take some calls and we can respond to them. Alexis joins us from Hampton. Hi, Alexis, you're in the air.
Oh, hi. Thank you very much for taking my call. Fascinating topic, and boy, is it on point for our current times.
Thank you. You have a question for our guest?
Actually, I wondered about one aspect. There seems to be a racial aspect, an age aspect, but I'm wondering about the economics. These practitioners, when they get especially a young person, they don't really have to engage the young person that much. They do a little talking, they get the diagnosis, they start a prescription, and bang, they've got a repeat customer. They may not be doing this as evil or negligent practitioners. It may not be very conscious, but it is money coming in. Oh. It is to their advantage.
All right, let me let our guest respond. Thanks so much for the call.
Well, regarding economics, I did have a child psychiatrist say to me years ago, Gretchen, if a child comes to see me, he or she's going to leave with a prescription because that's what I do and that's how I get paid. And that's what modern day psychiatrists do. They are rarely anymore in the business of engaging in psychotherapy like they once were. They do med checks and prescriptions for the most part. So is a factor.
I would just throw my 2 cents worth on that one. As a practicing physician, for me, there's no hidden benefit to doing that. I've had a lot of people will say, that we prescribe a drug, we get paid extra. I asked them, I said, would you tell me where that's coming from? Because I've never received any extra checks for this kind of stuff. I tell you what it boils down to, in my opinion, is the moralistic value of the practitioner. When I took my Hippocratic oath, I took that seriously. The first thing is part of that is first do no harm. So, if talk therapy, is it's kind of like an example, like for hypertension, not to come back to something like that, but, when I see a person for hypertension, the first thing I have to do is a examination, a history exam. Then I have to look at them and say, okay, what does the evidence-based research say how you manage that patient is based on several factors. Other medical problems they have was their blood pressure at the time of the initiation of that, my visit. And then you go, okay, what is we have a governing body that dictates under this circumstance, this is what you do. And these are the proposed steps. And it may involve medicine, it may not. So, we have in cardiology world a very specific set of rules we have to follow that, and it's evidence-based, So now the thing I don't know, and the thing that troubles me with this conversation is whether or not in the psychiatry world, do they have the same ethical rules that apply? And I don't know the answer to that. They may not. But, what I have seen is if you look at it from that perspective to say this person has this potential psychiatric issue, what's the process? Go through that first thing. If you interview them, and sometimes you have to see them more than once to make a diagnosis. If you're talking to them 5 minutes and you make a diagnosis, I have to have some suspicions myself.
I was going to ask you, can you make your determination about the blood pressure in a 10-minute interview?
No, because the rules dictate you can't.
Yeah.
We have to have 3 separate readings that are elevated in 3 different circumstances. So again, our rules are so specific, and I just don't know if this one, but that it just troubles me to hear that you don't have that, because you can't do it in 5 minutes. I don't care who you are. Nobody's that smart.
Yeah. Let me let Gretchen respond, Keith.
Dr. Newby, you bring up a great point. Of course, the psychiatrists and other physicians and nurse practitioners who are involved with prescribing these drugs operate under the same ethical standards that you do. They commit to first do no harm. The tricky part with mental health is that we don't have any objective or empirical biological markers for any one of these disorders. And we now know even the people who put the DSM together, the head of the task force for the DSM-4, for example, Dr. Alan Francis, has come out and they've admitted that these diagnoses are basically constructed through committee votes, and they have not yet been scientifically validated or established as reliable. So what that means is when you're looking at a mental health diagnosis, it is in the eye of the beholder. Whereas when you're making diagnoses, Dr. Newby, you're looking at things like blood pressure and other kinds of metrics, a range of tests, blood tests, and EKGs, and many things, I'm sure. We don't have that in psychiatry.
Let's take another call. Our phone lines are lit up. So let's see. Syra, and I hope I pronounced that correctly, from Williamsburg. You're on the air.
Thank you. You pronounce it perfectly.
Thank you.
I'm a pediatrician, and we are kind of at the bottom of the totem pole as far as getting paid is concerned. And I'm married to a child psychiatrist, and he doesn't get paid much either. So we're not making a lot of money here. I just wanted to comment that it takes time when you try to make the diagnosis. So you can't just take 5 minutes. It takes a long time. And the children, I see all kinds of kids, all races and backgrounds, and foster children too. There's a couple of very important things you have to do. You have to make sure that their sleep cycles are okay. Like if they're snoring at night, you need to get a sleep study to make sure they don't have sleep apnea, because they can really interfere with their behavior in school academics. And also the therapy, I totally agree with that, but it's very difficult to get anybody into therapy right now. Everybody's so backed up, so that's also a concern. You want to get kids in, but you can't find a therapist for them. And we use stimulants for ADHD, not psychotropics, as far as I know. So I just want to correct that usually the stimulants and some other medications that are available too.
Okay.
But, that's just my comment. Yeah.
Thank you so much for the call. I appreciate that. Gretchen, you wanted to respond?
Syra, I really appreciate your comments. To your point about what psychotropics might be used for children with ADHD in our community, actually, I looked at that very rigorously over the years in the past. And in Hampton Roads, among children who were diagnosed with ADHD, almost all of them were medicated. And 28% of those children who were medicated were on 2 different types of psychotropics at the same time, usually a stimulant, like Adderall or Ritalin, and an antidepressant. A full 8% were on 3 different types of psychotropics simultaneously, and 1% were on 4 different types. And that was in 2000. And the situation has only gotten worse in terms of practitioners being comfortable putting children on multiple types of psychotropics at once. And a stimulant is a psychotropic.
Okay, I'm going to try to get another call in, and then I have another question for you. Christopher joins us from Virginia Beach. Hi, Christopher. You're in the air.
Hi. First time caller, long time listener.
Thank you.
But I was listening to your program today, and I heard Sade. She said something about the zombie effect. My son was prescribed these medications, Concerta, Ritalin, and all that, and he had that same effect. And my wife and I, we were like, no, this is not working. So we just took him off of all the drugs, changed the diet, changed the sugar, fruits, vegetables, and he improved. He still was a little hyper, but it improved dramatically. He was diagnosed with ADHD, and we moved, went to another school, and I have to say, Principal Sessions, she called us in one day, and we're like, uh-oh, what's happened now? So we get there, and she says, there's nothing wrong with him. He's just finishing his work faster than the other students. He's a kid. So he was like 7, 8 years old.
Yeah. Yeah.
And so from there, she said he recommended advanced classes, and from there we had no other trouble.
issues. Christopher, thank you so much for your call. We really appreciate that. Let me ask you this, Gretchen. What should parents ask when they are told that their kid should be diagnosed for, or they're told their kid has ADHD or any other mental diagnosis that would require them to be put on drugs? What are the right questions that they need to ask before they say yes or no?
Well, first of all, I'd ask, how do you know that? And hopefully they'll realize in the answer they get that it really is a subjective decision. And then the second thing that I would encourage parents to have a conversation with the practitioner about is, what else could this be? Because most of the time it's actually a relationship issue of some sort, whether it's the relationship between the child and the academic curriculum, or the child and other children in the school, or subtle family dynamics that are causing anxiety in the child. All of these things can make a child look like he or she has ADHD.
Mm-hmm. And should parents request that something else, some other kind of therapy be done before? In other words, making the drug the last resort as opposed to the first?
That's a great point. Yes, the medication should be the last line of defense, not the first line of defense, because we know children who get good behavioral therapy before they've ever been put on medication will completely resolve their symptoms up to 70% of the time. That's with good, really well done behavioral therapy. And even if you only reduce the symptoms, sometimes that's enough to get beyond the bump that led to the child to being identified as potentially needing a label and medication.
Mm-hmm. Brianna joins us from Portsmouth. Hi, Brianna. You're on the air.
Hi, guys. So I was calling because I have 4 kids, and 3 of them have like special needs. 2 of them are ADHD and one's ADD, and a bunch of other stuff. And we have had a really different experience than what I've been hearing. Mm-hmm. We went to a company that used to be called Christian Psychotherapy that doesn't exist anymore. And my kids had this amazing psychologist, Dr. King, who was like, your kids have ADHD or ADD, but we're not going to try medicine first. Here's the kinds of therapies that you need to look for and find a therapist that's qualified for that. And then she and her staff hooked us up with people that specialized in what my kids needed. And a few of them, or 2 of them, ended up needing to be on medication because they really had struggles, not just in school, but even in just being a kid, normal life. Mm-hmm. But it was a solid year after diagnosis before any of them went on any kind of medication. And that we have had fantastic therapists, and it is really hard to get into testing and to get even a therapist and psychologist here in Hampton Roads. There's a huge shortage. But in my experience, those that are here are like gold. Mm. Like, they're irreplaceable. And they have worked so hard to keep our kids off of medication and to minimize any medications they do have to be on. Great. So I know I've heard a lot of people saying that they hear different, but my experience isn't that at all.
Well, your experience just mirrors what Dr. Watson just said in terms of looking for medication being the last resort as opposed to the first resort. Let me just ask you one quick question, Brianna. Would you encourage people, parents in particular, who are dealing with this, is patience a major virtue in terms of being able to get through this process?
Oh, yeah. We have... there were times where I was like, is my kid going to be an adult before we get them tested?
Wow.
Because it just felt like we were on waiting lists forever. And I know that all the schools in Hampton Roads who help with their, training therapists, training psychologists, and all that are really trying to equip and recruit people to go into this field. But we just don't have enough people who want to go into it. It's a stressful job. So I understand that. And honestly, for me, it was being that squeaky wheel, like calling, every week and being like, hey, is there a spot for my kid to get tested yet?
Gotcha.
And it's a pain, but when you have, 2 of my kids are very special needs. And you got to be that squeaky wheel sometimes.
Absolutely.
It's annoying. And then, and it pays off.
Okay.
One of my kids, Dr. King, was amazing because she was like, I don't think this is a psych problem. Let's get your kid a sleep study. And we found out my kid was narcoleptic.
Wow.
And it
Brianna,
was
we
like,
could
wow.
talk to you all afternoon, but we're almost out of time. But thank you so much for calling and sharing your experience. I appreciate that. Sade, let me ask you a question. How do we get all of the social workers, lawyers, child care advocates, everybody that's involved in that foster care system brought up to speed so that they too can make some changes in the way that kids are diagnosed and drugged, if in fact they wind up giving them drugs? Or can we get them to turn and maybe think of some other types of therapy first?
Yeah, so I definitely think that re-education is like a really important part of this. At this point, medication is as much as of a part. I mean, psychotropic medication is as aligned with child welfare systems as foster homes. Like it's a part of it. So like in watching Medicating Normal and seeing the documentary and the ways in which it depicts just the impact of these very heavy drugs on adults, I think that a real campaign and engagement with these providers, the social workers, the attorneys, the foster parents around, what are the real effects of this? Long-term effects of it, and how we can make sure we're making decisions for young people with young people collaboratively, and also really thinking about the whole person, because oftentimes reconnection to family is absolutely a way to mitigate some of the behaviors young people are experiencing care. Connection to extracurricular activities, therapy, but therapy that's based in culture. So like being able to have providers that actually look like you sometimes, like those things actually are very impactful, but oftentimes they're the last things we're looking at. So I think re-educating, so this film, Medicating Normal, and making sure people are able to see full scale what this impact is. And then two, us engaging in like real community building with young people. It's the best means of of supporting youth in their development, and also to really combat the impact of trauma. And again, I really push that, because when we're talking about children in foster care, oftentimes the impact of trauma is reduced to look at the behavior and oftentimes associated with mental illness. Let's actually start at the core. And I think a big part of that will be re-education.
Wow.
And it's happening.
Thank you.
It's definitely already happening.
Sade Daniels is with the California Youth Connection. Sade, thank you so much for sharing your story and sharing your information with us. We really appreciate it. Thank you.
Absolutely.
And Gretchen, I want to ask you this. Are parents, first of all, tell us again where people can come see the film.
Okay, so January 26th, that's next Thursday evening at the Sandler Center. Doors open at 6 p.m. The film will start at 7 p.m. It's such an important film that the Richard Fee Foundation is making sure this can be seen for free by anyone in our community. So
Do they
free.
have to sign up?
We would like them to register. You can register at the through the Fee Foundation, or you can register through the Sandler Center. So Periscope Foundation, which is connected to the film Medicating Normal, and the Richard Fee Foundation are making sure it's free and open to the public. Thursday, January 26th, doors open at 6 p.m. We want to pack the house. We already have over 450 people registered, but we have lots more room. So
Is there
please
a website?
come.
Let me see
Yes, you can go directly to richardfeefoundation.org/event. But please come, bring friends, bring family members. We know that some of the school systems are now looking at pressing out information about it. It's really important.
So we have 2 minutes left. I want to ask you this. Are you advocating no medication, or are you advocating become informed?
We're advocating become informed so that we use these medications safely and judiciously.
Because in some cases it is necessary.
Yes, we are not an anti-medication group or event. The film is not either. It's about informed consent so that we can use these drugs safely and judiciously.
That's Dr. Gretchen LeFever Watson, who is a clinical psychologist in Virginia Beach. Dr. Newby, you got the last minute.
Oh,
Literally.
Well, I would just say this, like anything else in life, you have to take things, I would say parents, make sure you're informed on the recommendations and the research that advocates the use of medication. Make sure that the talk therapy is invoked and utilized, To me, I think that's where it begins. Everybody has to be informed. Everybody has to understand pros and cons, risk benefits. Once that's been looked at and ascertained, I think then you can move forward to whatever that therapy would be. Absolutely. But I definitely advocate talk therapy in addition to any potential use of medication.
Okay. Thank you. That's Dr. Keith Newby, my co-host for Another View on Health. Thank all of you for joining us on this conversation, and we'll be right back.
I'm with Marcellus, and you all are checking out Another View. Don't go anywhere. Check us out.
And welcome back. If you've ever picked up an Ebony or Jet magazine or visited the fashion fair counter for makeup, you're about to meet the woman in charge. Linda Johnson Rice has been running this multi-million-dollar conglomerate for the past 3 decades, and she's coming to Norfolk next week as a keynote speaker for the Norfolk Forum. Our Lisa Godley spoke with the woman behind what millions call an American staple.
Linda Johnson Rice is a woman on the move, but the adopted daughter of John and Eunice Johnson originally had her sights on a different path.
I studied opera in high school, and I had a voice teacher. And I actually thought about, maybe being an opera singer would be something that I would pursue. But the media business was far more appealing to me.
She says her parents made sure she was exposed to all they were building.
I just went to the office after school. That was sort of my stomping ground. And I'm sure I was probably annoying to many editors as I ran in and out of their offices at age, 6, 7, and 8, and watching them lay out pages of the magazine and just poking around as a kid. So I kind of grew up in the business.
Rice would go on to study journalism at the University of Southern California and earned her master's in business from Northwestern's Kellogg School of Management.
Part of the reason of going to school and getting the business degree and getting the journalism degree was that, at least on paper, you couldn't argue with the credential to back up the position. But, I think in order to be taken seriously, of course, you had to be serious. And also, I think my father and my mother were very good at paving the way within the company of listening to me and taking me seriously.
Her years of experience have taught her a lot, and she shares this advice.
The first thing is you've got to be passionate about what you want to do, and you've got to be committed to that. You've got to be committed to that and be as knowledgeable as you can possibly be. And a lot of times, there are going to be really hard knocks. My goodness, I know I've had my challenges, and no one is immune to that. But I think for Black women, you've got to be passionate and you've got to stand your ground for what you believe in.
For Another View, I'm Lisa Godley.
And you can hear more of Linda Johnson Rice next week right here in Norfolk. She is the keynote speaker for the Norfolk Forum's event on Tuesday, January 24th at 7:30 p.m. at Chrysler Hall. Tickets for the event are available. You can go to thenorfolkforum.org/tickets. That's thenorfolkforum.org/tickets. We hope you found the information shared today enlightening and that you will share it with others. Go to anotherviewradio.org and download the podcast to listen to it again. And please sign up for our eView newsletter so we can keep you informed about upcoming programs. Next week on Another View, oh my goodness, an entire hour with Congressman Bobby Scott. We're going to get the backstory about what's been happening in Washington. Our theme music was created especially for Another View by Jay Sennett. Lisa Godley is our show producer. Jordan Christie is our audio engineer. And Danielle, whose last name I just forgot, Danielle Saunders answered our phones. I'm Barbara Ham-Lee. Stay safe, be well, and be sure to join us again next Thursday at noon for Another View.
Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.